setting new standards in podcast excellence. You have joined the WBT, fully focused on business and taxes. Here is your host, Michael Lodge.
And thank you for joining the WBT and Michael Lodge here. I want to go over the repeal and replace of ACA, or the Obamacare Act. There is a current bill that is before the Senate that they're considering, and the CBO is working with the senators to kind of explain what the bill will do. It's called the Graham-Cassidy Healthcare Bill, set out by Senator Graham of South Carolina. One of the issues that we've seen is that Nancy Pelosi and Schumer and talk show hosts and everybody else are getting out there and saying, you're not going to be able to, if you have existing conditions, you're not going to be insured. It's a lie, because it's in the bill. The bill states that states have to make sure that there is insurance available for those people with existing conditions. So that's a lie. Gavin Newsom of the state of California, Lieutenant Governor, is putting out these lies every single day. And that's all they are lies, and how people are going to die. So let's go over what this bill actually will do, okay? One, if you have pre-existing conditions, you will still get insurance, okay? Will you have to buy insurance? The Affordable Care Act, remember, put in place those mandates to buy insurance with the tax penalty if you were uninsured. Though the Graham-Cassidy bill would get rid of those mandates and the penalty. The mandate was created to ensure that young and healthy people would buy insurance. And it was supposed to offset the cost of insuring older and sicker people. But it didn't work, okay? It just did not work. And people were getting so hit with tax bills at the end of the year because things changed in their subsidy program. So, will you have to buy insurance by law? No, that goes away. Are employers required to provide health care? The bill would repeal the penalties for large employers that fail to offer affordable insurance to workers. Do insurers have to sell coverage? If you have a pre-existing condition, insurance companies still won't be able to deny coverage based on pre-existing conditions. But states can waive the provision that caps when they can change, or what they can change, I mean. They can also waive certain mandated coverage under Obamacare, such as maternity care, mental health services, and hospitalization. So you're protected, okay? If you have a pre-existing condition, you can still get insurance. What happens to the private insurance subsidies? The bill would end subsidies in 2020 for those who purchase insurance on their own rather than getting it through an employer or government program. Under Obamacare, people earning up to 400% of poverty get subsidies to reduce their premiums. So that's going to go away in 2020. What happens to states that expanded the Medicaid? 21 states and the District of Columbia expanded Medicaid under the Obamacare to people earning up to 138% of poverty. The Graham-Cassidy legislation will immediately stop more states from expanding Medicaid and would end the existing expansion in 2020. Instead, states would receive through 2026 a block grant to devise their own way of helping residents who had gotten Obamacare coverage either through Medicaid or with private insurance subsidies. So what happens to other federal Medicaid funding? The legislation would change the way traditional Medicaid is funded. Instead of reimbursing states for most of the cost of caring for Medicaid recipients, the federal government would send states a per capita allotment with limited growth. States could also elect to have a Medicaid work requirement, though disabled or pregnant people would be exempt. How could Medicaid funding be redistributed among states? States that expanded Medicaid or have more people receiving private insurance subsidies through the Obamacare marketplaces would lose funding to other states. Those that didn't expand Medicaid or have fewer people getting help through a marketplace could initially see an increase in funding, but all states would lose money in the long run and during recessions or other times of increased need, according to the left-leaning Center on Budget and Policy Priorities. So we have to put that into a little bit of concern because it's a left-leaning budget and policy. So again, we don't know what that will do until we see the final outcome of the bill and the scoring of the bill. Would young people still be able to stay on their parents' plans? The plan would leave in place a provision that allows people under age 26 to stay on their parents' health care plans. Would Planned Parenthood still be reimbursed for services? It's already illegal for the federal government to pay for abortion services. However, the government currently reimburses Planned Parenthood for non-abortion services that are covered by Medicaid. The Graham-Cassidy bill would end the practice for a period of 1 year. The bill would provide money for community health centers in an attempt to supplement the coverage that will be lost from Planned Parenthood. Now, the liberals are going to go after that because Planned Parenthood is their baby. But it's only for 1 year, and it's so that and let me tell you, everybody thinks that Planned Parenthood is the only option out there for medical care for individuals in certain communities. It's untrue. There are dozens and dozens of medical facilities out there for the lower income individuals. And it's there. And people are taking advantage of it. Not just Planned Parenthood, but there are other facilities out there that are doing exactly what Planned Parenthood, but they don't get the same amount of huge dollars that Planned Parenthood has gotten in the past. But there are good facilities out there providing the same medical care that Planned Parenthood has done. So that's basically it. So all of this hoopla and all these lies being told by liberal Democrats, especially Gavin Newsom. My gosh, I've never seen such a negativity coming out of his state of California. He lies upon lies upon lies, and he is misleading individuals, saying that they're going to die, people are going to be killed. I mean, it goes on and on. But I'm fighting him on that because he continues to spread lies about certain aspects of the healthcare bill that he knows nothing about. And it's not just him, but Jimmy Kimmel. What in the world is he doing on late night television talking about healthcare? We watch television to be entertained on talk shows, not to get a lecture on something he doesn't know and what he lied about of pre-existing conditions being terminated is just worthless. We do not know the total end of this bill because it's sitting in the Senate. Senators are writing amendments. They're adding it to the bill. So by the time we get this bill to a vote, it's going to be a slightly different bill. But it's keeping the same core of what I just described to you on what's in this Graham-Cassidy bill. So before you start spouting your political remarks, look at the bill first. Understand what the bill does. This nonsense of Pelosi coming out and something about racial, I don't know what she was talking about, but she was off onto a left-hand corner that what she said is that Republicans were trying to sneak it in because they're being helped by the hurricanes, they're being helped by the United Nations meetings this week. So she's claiming that the Republicans are sneaking it in. I tell you, politics is dirty, isn't it? A lot of times these politicians stand up there and they don't care what's being said. They just spout it. It comes off their tongues. It's the same old, same old. It gets so annoying after a while and tiresome that no one... Listen, if the Democrats want something on a healthcare bill and they want to clean up the mess that they did with ACA, sit down with the Republicans across the table, come to the table and talk about it. But instead, they're yak, 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 yak over here and yak, 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 yak over there, and they're accomplishing nothing except looking more stupid. If you want a clarity on a bill, go to the other side and sit down with the writers and find out what's in that bill before you start spouting. I think they must have a whole bunch of people that say, okay, XYZ on the GOP is going to come out with a statement. Okay, let's come out with another statement over here and let's really downgrade them and let's put them down and let's call them names and everything else. I think that's all they do on the other side. They don't participate. Instead, they just sit there and spout nonsense. So if you're going to start spouting nonsense, make sure that you've read this bill. Make sure that you've read anything that you're going to spout something on so that you have a good argument. If you're just going to sit there and spout nothing but political jargon, you're wasting people's time. If you have a legitimate argument as to why XYZ is being done and what you feel it should be and how it's going to harm people, argue that point. But don't sit there and call people names because you have no argument, because you've run out of lingo that has been trashed over and over and over again by a political party. So anyway, I just wanted to spend a little bit of time with you and kind of tell you what's in the bill. It's being changed as we're talking now, and it will be changed even more. And by the way, somebody told me that the CBO isn't even working on this. Well, that's false, because the CBO is trying to help the Senate kind of get some numbers together and kind of get some direction on what it could and cannot do as a bill. Even Politico reported that today. So get to know the bill, read up on it, see what it's going to do. If you have a good argument, make the argument. But if you don't have a good argument and you're just going to spout a political agenda, it's not worth it. Know what you're talking about. So that's what's in the bill. I'm concerned about the tax issues because it doesn't take ACA had 21 taxes in it, and it's only removing like 2 of them on medical equipment and on the subsidy tax issue. Those are going away. But all the other tax things are still in there, and those need to go away too. But I think that has to be done through tax reform. So if anything is done in tax reform, they need to address all those taxes that were snuck in to the Affordable Care Act. Obamacare had taxes in it, 21 of them, and they need to go away. So that's it for tonight. If you have any questions, just send me an email at mlodge, M-L-O-D-G-E, at lodge, lodge-co.com, and I will try to talk back to you. I will try to answer your questions if I can. But send me an email. And go to our website at www.wbtpod.com. And all of our blogs, all of our podcasts, everything is there for you to keep up to date on. So if anything changes tax-wise on this, I will let you know. I'm studying that very carefully because I'm going to